Hello and welcome to SRBC 2022 conference, and we are back with another interview with Professor Gopalan. He's a professor and head of Department of Public Health and Epidemiology in Central University of Tamil Nadu, and we'll be talking about public health and how it deeply affects not only villages but in civic and tier 3 cities as well, and how if not maintained properly, we are all going to be doomed. So let's educate ourselves in public health and why is it important with Professor Gopalan. So welcome.
Thank you, Ms.
Welcome, sir.
Yes.
So we would like to first understand actually what is public health and how is it different from normal health? Like why is this term public health is derived?
Yeah, anyway, I am professor from Central University of Tamil Nadu, Gopalan. I was there as a scientist in DRDO, moved to the Central University, wherein one of the important area, the public health, the epidemiology. The public health means people have to be educated, how we can educate the people. So one of the wonderful example which we had it during COVID period, we were educated how the disease are being transmitted, how the disease being contained. The people have been showed. That's the thing which really gives a important nature. The disease containment is very important. So once we know the disease part, really these are all the disease being transmitted, and then how people are educated. Once you educate the people, they themselves will contain the disease. So that's the thing, public health, where the role, mainly the publicity, the talk, how the disease, what agent is transmitting, what is the environment which suits for the transmitting, and then how containment is very important. The containment, once you educate the people, they themselves will come to know, yes, this is possible by this, using it rather than using the drugs and other things. Once we educate, any disease can be contained easily.
So this is a really great answer about what does entails public health. So your lab works on studying the cause of cervical cancer as a public health problem. So would you like to say how cervical cancer is related as a public health problem?
Yeah, it is one of the things, the cervical cancer, if you see in worldwide, almost 5.7 lakhs people are affected by cervical cancer. So cervical cancer is mainly caused by human papilloma virus. But in India, we have almost 1,22,000 cases, because mainly this disease is initially which was seen as a rural disease, because the sanitation problem, the people really, the women they don't know about the disease, because initially the body pain, back pain, or excess of bleeding and all the things, they do take it normally. This is a routine problem. Once which can be diagnosed taking the pap smear and then check about the cytology. We have seen some of the cases in Madhya Pradesh when I was working in DRDO, some of the villages. Really, generally we used to go for the camp to the village. So I was one of the member for that one to see the malaria smear and everything. But really, if you see it, almost 20% people in the village population, they were having the pap smear positive. By the with the help of the lady doctor, they took it and then showed. So because the poor sanitation which caused, and then once we educated, the stage 1, really the papilloma virus infection causing cervical cancer can be cured easily if you know the early stages. And then some of the vaccination which are all there nowadays, it's a clear-cut vaccination which are all there, so which is possible to containment the disease. But when you see the public health, yes, public health is important. People have to be educated. How the sanitation is very important. If as I was talking earlier, 1 or 2 girls are the if you can educate people, they can do the entire village. They will take care of it. That's what cervical cancer can be contained by educating people. That's what my feeling is.
That's a really great answer. But I would like to emphasize that public health affects all. So why cervical cancer only women gets affected? What happens to men?
Yeah, because you see, as the cervical cancer, if you see it, the between the woman is mostly affected because of this is a poor hygienic condition, the sanitation. But men few cases were there because they got it mainly from the multiple sex worker. They got it. Otherwise, men generally they don't get it. The female is most of the cases due to cervix. When you see the 40 years, almost 40 years of women, almost 70% positive in India, mainly the Arunachal Pradesh, and then other states, the Kerala, which is less number of cervical cancer, and then 30 to 39 years, 21% positive for the woman. Because men generally get it, the multiple sex worker, otherwise they don't get the disease, mainly the poor sanitation of the woman, all the things. And then below 20 years, they don't get it, generally the woman or men, they don't get it, the cervical cancer, positive cases.
It is really enlightening. So I would like to understand that when we talk about public health problem, we oftentimes imagine a village or a rural area. So is public health always a rural area problem, or is urban areas are equally affected?
Yeah, urban area, yeah, it's a very good question. Urban area also too affected, because these days, see, most of the villages are going to, converted into semi-urban area. I don't see the rural area as rural area. Yeah, town or urban area, people are getting educated by the pamphlets, by TV, by smartphone and everything. But village level also is coming. But as we were talking early, the multiple sex worker in the urban area are more. That's why the disease spreading also in fast, not only for the rural area, other areas, urban area, which found to be the positive for the cervical cancer.
So, is cervical cancer the only outcome of a bad public health problem, or are there other diseases, infectious diseases or acquired diseases that can be outcome of lack of public health?
Yeah, because this is mainly lack of public health only. Sanitation, as we have been talking about, if you have the good sanitation anywhere else, you take the urban or rural, I don't think we are all going to get the disease. The infection rate definitely will be reduced. So I would consider as a public health problem of cervical cancer is being spread. If you take care of it, sanitation, 100% we can eliminate these diseases.
Okay, so lack of sanitation is the primary cause of all of these branching out disorders.
Yeah, definitely.
So how do we improve public health? Like, are there education programs running or training programs through which we can educate people how to maintain better cleanliness around them to establish better public health?
Yeah, it is. That's what our lab is mainly, the epidemiology and public health. We are all concentrating on that one, how to educate people. So we have the 18 MSc students. We do give some of the dissertation work. They do go to school, they do go to aged home, they do discuss about all the things. They do tell about, yeah, these are all the things, mainly the hygiene condition, food, what food they are all taking, how they are all taking it, and then public health policies, which they are all, these are all the policies which are all there. Probably you can learn it by pamphlets, learn it by other things, which is possible. So some of the things which the healthy worker, mainly we have to educate the people. Some of the volunteer local service organization or the NGOs are there, we can educate them. They do go and tell about the people. Then improving wider determination of the health, because their health status, how their health status is good, most of the disease can be eliminated. This is also one of the things with health improvement, health care, prevention, creating awareness, monitoring community level. You see, every time we have to do it when the students or along with the doctors, we have to conduct some of the medical camps. That's very important. When we do the medical camp, most of the disease, unknown disease, these are all the disease can be prevented or can be educated people. These are all things, yes, it is possible. Then promoting the physical activity. These days physical activity is getting reduced. Probably people are not much walking, with the hygiene, the pollutants, the smoking, the passive smokers. When we talk about the urban area, the passive smokers are more. One way it is getting reduced now because COVID, which taught us no one was smoking, but other way they were taking the gutka and other things. And there the oral cancer also, which is improved, means the oral cancer cases were more. So somehow the disease can be prevented by educating people, and then preventing disease outbreak. Once you educate the people, they themselves will understand how the disease are transmitted. The prevention is possible. And also containment. What we do it, epidemiologists or public health epidemiologists, entomologists, we first we assess the data, what are the data which are all there. Once you see this is environmental condition, this many population are there, this many food habits, these are all the aged people or children, school going children, male, female, all the things. So what are the disease which are all there? If the disease which are all there, the same environment in other area, if you containment, this type of environment causes disease may cause in future. So the main thing is the burden of the disease in that location. How forecast it? Once you forecast, this is a situation, this many people are getting disease because of this reason. The other places we can tell about. If you don't have this type of environment, your disease prevention, containment is easy. That's the thing, it is possible. Yes.
So do you have an advisory or a set of suggestions for people in those demographics where public health is an everyday problem?
Everyday problem.
Yeah.
Yeah, mainly the hygienic condition. I would say the food habits. When we see in India, the COVID period, so our food material, whatever the food material, which mainly the phytochemicals, which took care of us, the preventing disease or the transmitting disease or early cured the disease. The same way for the other disease also, yes, it is possible. When we can say the Indian environmental condition with the worldwide is a totally different. We are all exposed with most of the agents. So that's what the immune system also plays very important role. The cervical cancer also, the same way immune system is good, the disease will take care of it. Disease spreading will not be there. So one of the important area where I do consider the health part is very, very important.
Yes. So how do you picture the public health of India versus the public health of the other countries, like premier country, US or Europe?
Yeah, public health, they are well advanced. They have started much earlier. We have started bit late. But I have always an example for the dengue control, the malaria control in India, as well as the COVID control in India. It's a really amazing, which we have done it recent past. We contain most of the disease. Dengue, yes, we know that the mosquitoes which are transmitting, mosquitoes are breeding with you, transmitting with you. So if you can eliminate the mosquitogenic area in your place, I am sure the disease dengue is controlled. Now people are educated. Other countries which they started, compared to other countries, the immune system, I would say India is very good. That's what most of the disease which we are all escaping from the disease. So public health awareness program which we have started in a big way. But people are getting, see now, because of smartphone, because of pamphlets, because of TV, all the things which made us to learn how the disease is being spread, and then the containment of disease, it is very easy. We have been improving upon in public health and epidemiology point of view.
Yes, this is really nice actually to understand that we are doing better in some cases in India, because obviously we are acquired immunity
You
in
mean,
the first place.
yeah, madam.
Being a tropical country.
Yes.
So, and that's one of the ways that we are escaping a lot of diseases. On the contrary note, in our rural health, if we establish better public health programs for
Yeah.
cleanliness, for sanitation, if there are proper washrooms for women so that better sanitation can happen, I think the public health problem can be controlled.
Definitely, 100% I do agree with you, because central government, state government, they all the open the defecation which were there earlier. Now they have they are making awareness in one place where the bathroom which is being constructed, so that water contamination which are all not there, whatever the river bed, whatever the canal, the contamination is less, waterborne disease which got reduced, as well as the child which we don't know, the sand and everything, open defecation which is reduced, that's what the contamination is less. And then other part, when you say the food material, the hygienic food which were people, COVID taught us in all the things, wash the food material, raw food material, vegetable, fruits. So that's what the public health, they educated now. So most of grassroots level which is educated, village level really it is improved. And they know that the food material, seasonal vegetable, seasonal fruits, the preparation, all the things are educated now, people are educated. So they are all doing better job.
So do you really think that this was education or this was fear that was driving them?
No, initially it was fear, slowly which come to yes, unless we do it. See, those days, if you see it, the olden age, so the chapel, whatever shoes which we are wearing, people they said don't bring your shoes, chapel inside the house. The COVID period which really we did it, the disease, the washing hands, as my grandfather used to tell, whenever you go out, when you come to home, you have to remove all the dress, whatever we wore it. So take bath, wash it your hand, wash your legs, all the things. When you enter it, disease is contained. The same way which COVID, which we have done it. That's what one of the things. And then whenever we used to have the always clean dress, wash it, don't use it the second time. So that also which contain the disease management. That's what we do. We do educate in Department of Epidemiology and Public Health for all the people, rural area. We got some of the projects, the food material also, whatever food material which they are all taking, how they have to prepare it, how they have to store it, all the things we do educate the people, so that better food, nutritious food they have it, then immune system will be good, the disease management is very easy compared to other things, taking drugs and everything, mainly the medicines.
We had a really interesting chat with you because we literally went up a circle. We started with a public health problem and we somehow was able to relate how historically it was relevant, how our ancestors were continuously telling us the same, and now when scientists are also saying, we are getting reasonable reasons for like why what they said was right.
Yeah, so it was really very good, madam. The food material also. See, during COVID period, never we had hotel. We had a good preparation at house. So when we prepare at home, what we are eating outside, never we know. The fast food also, when you compare to cancer cases, India and abroad. So India, whatever the phytochemicals, whatever food materials we do, we don't eat any fast food compared to Western countries and other European countries. Now we started it because we too all are going job, which was not possible. Earlier it was a joint family, now it is a single family. All the things we have to go for job. We are all taking the food material outside. The chances are getting the carcinogenic material, mainly the pesticides. Now, how I am not against any of the hotel or food material, but the thing which made us to eat outside now, the chances are getting more cancer cases in future. If we can be able to do something for the food material, nutritious food material to prepare at home, take it with us, the disease containment, yes, the disease prevalence, which is easy. But the same way, the monitoring cases, the cancer cases earlier, the diagnosis part were very poor. Now we have improved upon all the instruments, the fast result, the fast diagnosis, many cases which are coming in India. Hope so, we will do a better job in future by educating people. Thank you, madam. Thanks a lot for your kind, all the things which you have been asking. Public health is one of the important. People may not be knowing, early days. Now they are all, they want to know about each and everything. If you don't know anything, the Google is a good master now. We can get the information in no minute about disease. And then, thank you very much. Thanks a lot for me to be with you for this evening. Thank you.